All right, great. So I appreciate having the opportunity to talk to you all about ALICE. And I think it's really critical information for our community, for the state, and for the country. And we certainly use this information on a regular basis. So ALICE, if you're not familiar with it, is an acronym for Asset Limited Income Constrained Employed, or possibly a more technical term for the working poor. And we know that traditional measures of poverty really do not capture the magnitude of people who are struggling financially. So what I'll be sharing with you today is data from the 2020 ALICE report, specifically for the state of Wisconsin. I'm going to sprinkle that with stories and example basis. And I do tend to be a bit of a data geek, so I'm trying not to go too deep into it and do more of the sharing stories and examples. But I do think, again, it's important, and feel free to ask questions as we go along. To put the report together, it is a national initiative, but in Wisconsin specifically, we have 6 researchers, in addition to an ALICE research advisory committee with 11 members, academic members, and then Regional United Way staff representatives. And the data and the methodology are updated every 2 years by the national research team. And what I'm going to be sharing with you today is actually information from 2018, because as you can imagine, the data is always a couple of years behind. What I think is really important is that oftentimes these neighbors of ours tend to be a little bit invisible. And it's the success of our overall community really is related to the financial stability of all our residents. So our ultimate goal with this is to catalyze action. So ALICE is based on a household survival budget. It's put together looking at the basic cost of household expenses, including the things that you see here on the chart. And we get a figure for 3 different categories: for a single adult living alone, for a senior adult living alone, and then a family of 4 that would include 2 adults, an infant, and a preschooler. And you can see that an actual household survival budget is, for that single adult, about $21,264 a year, slightly more for a senior, $24,000, and for that family of 4, just about $68,500 in order to make ends meet, just kind of meet the basic expenses of daily living. So if we compare that to the federal poverty level, which is actually much lower than that, so it's only about $12,000 for that single adult, $25,100 for the family of 4. So there's a pretty significant gap there between the federally defined poverty level and what it actually takes to get by. One of the big challenges here in Wisconsin and across the country really, but in Wisconsin specifically, is about 60% of all jobs are hourly, and 59% of them pay less than $20 per hour. And so again, in putting this together, the ALICE research team also looks at what they call the Essentials Index versus the Consumer Price Index. And so what you see on this household survival budget really is that Essentials Index, those very basic things that you need in order to get by. And that Essentials Index tends to increase in cost at a higher rate than the Consumer Price Index. So if we look at 2007 to 2018, that Essentials has increased about 3.5%, whereas the overall Consumer Price Index only about 1.8%. So we know that there's a lot of worker vulnerability that increases while wages stagnate. And so despite lower numbers of unemployment in the state, what we do see are the growth in the number of low wage jobs, minimal wage increases for the workers kind of working in what we call ALICE jobs, and more fluctuations in hours, schedules, and benefits, which also increases family instability. So statewide, we'll look at some statewide numbers first and some issues before we kind of dig in to what's happening locally. But if we look statewide, about 11% of residents are below the poverty line, but a full 34%, if we take that ALICE threshold into consideration, are not able to meet those costs of daily living. And we can look at, from a diversity standpoint as well, Alice households in general are as diverse as the general population. They're composed of people of all ages, genders, races, ethnicities, and also living in urban and rural areas. But what you can see here is you look at total households for the state. Those in the blue dots for each demographic group are below the Alice threshold. The yellow dots, so you can see again, for some of our demographic groups, there's a disproportionate number of households that are below that Alice threshold. So specifically, those between 18 and 25 years old, Hispanic, Black, headed by a single family member, seniors, very disproportionately high there. And again, some of those other demographic groups, we see fewer percentage in that below that Alice threshold. Some of the trends that we're seeing, at least statewide, and I think that hits us locally, is a growing number of families that are on the cusp of the Alice threshold. So either like 10% above or 10% below that Alice threshold. So any small drop in wages or the number of hours that they get at work, any sort of unexpected emergency, such as COVID hitting us this year, can really destabilize a large number of households. And on the other side of that, if we've got a small increase in wages, if they recognize a decrease in rent or car payments, that can really help stabilize communities and families. Also, we're seeing increasingly a diversity in the state. And again, that impacts, we know that Alice numbers disproportionately impact those, particularly families of color. So while white households over the last 8 years saw a 1% drop in the number of families below the Alice threshold, all others experienced an increase, all other racial groups. So Black, there was a 6% increase, Hispanic, 25% increase, Asian, 38% increase. We also know that household structures continue to change. Fewer married two-parent households, or what we would previously thought of as a traditional household. Some of those changes can increase instability. Others don't really have an impact, but we know that those changes can impact the Alice numbers. Boomers and millennials both getting older, so we know there's a decline in working age households. And also millennials are waiting longer to have children. So that tends to sometimes impact the Alice numbers as well. Once they start to have children, and particularly if they're on that cusp of being at the Alice threshold, sometimes those added expenses of kids can cause more instability. And we know that the seniors are the largest age group with the largest increase in Alice households. And then of course, inequality in income and wealth continue to rise. And so Alice families just don't have the same means as other families do to build assets. And they're much more impacted by issues like lower pay for women, discrimination that may still exist in home ownership and rentals, and student loan debt as well. So seeing a bit of that information, what percentage of Waunakee households do you all think are living below the Alice threshold? Any thoughts? Maybe you can put it in the chat. Okay. And I'm not able to see the chat right now. Somebody kind of share with me some of the numbers that you're seeing there.
We've got everything from 15 to 25. 26.
So kind of 15, 20, that kind of range?
Yep, a couple bit higher.
Okay. So our actual in Waunakee is 24%. If we look at the whole area overall, kind of some of the other key areas, Westport's about 19%, Springfield 20%, Dane 23%. And so we're looking at about 1,922 of the 8,400 approximately households kind of in the greater Waunakee area or the Waunakee School District area. We know that about 8% of students are enrolled in the free and reduced lunch program. Prior to COVID, we had a very low unemployment rate. I haven't seen any recent figures, or I don't know if there are accurate figures out there right now. But we know that one of the big factors is housing in this area. And so as we look at monthly rental rates here, anywhere from $850 to $1,170 per month. And even looking at that household survival budget that we use for determining ALICE threshold, the number that they're looking there, even for a family of 4, is 767 on that national, household survival budget. So we know that our housing rates here do have a big impact on local families. So to give you an idea of how we kind of see that impacting us here locally, you can kind of see the growth here just that we've seen at Waunakee Neighborhood Connection. And I know a few weeks ago, the food pantry shared with us the increases that they're seeing as well. So if we look at the last couple of years, back in December 2018, we were serving 66 families. At the end of December, we were at 197. Just this month, we've added 10 more families needing assistance. So 207 client households currently representing 722 individual family members. And again, if we look back at those statistics, we know that, for our program, we're only serving about 10% of those in our greater area that fall under that ALICE threshold. We know a lot of them may have other support systems out there. A lot of them may just be on that cusp of ALICE, so they're making it okay month to month, but if something unexpected comes up, that might drive them to need further assistance. Some of it may be awareness too. So, for the time being, we've got in our plan that we want to increase the number of families that we're serving, since the demographics would indicate there are more out there. But long run, I really want to see this situation change and see fewer families that are needing assistance. So we'll kind of take a deeper dive then into some of those essential expenses, and I'll share with you here, some of the anecdotes and stories and real life examples that we see for our local families. So of those general household expenses, there are really 6 that are considered essential: housing, childcare and education, food, of course, transportation, healthcare, and technology. And for most families who are under or at that ALICE threshold, if they have children, that childcare and education is by far the biggest expense for them, particularly if it's a 2-parent household and both are working. So when we look at those consequences of insufficient income in these essential areas, there's a lot of connection between all of them. Each one sort of tends to impact the other. We know when there's instability in housing and they're unable to afford a place to live or to live consistently, there's instability then in school and work. If you're being evicted and having to move, or if you are temporarily homeless and having to stay with family or friends, that causes the kids to be pulled out of school, maybe move to another school district, or have gaps in their education until they get back to being able to live or have access to getting to their main school. We know it also impacts access to healthcare and food as well. Again, if housing is unstable, it causes a lot of problems for everything else. In terms of childcare and education, we know with a lack of access to preschool care or daycare, children may not be ready then to enter school or be at the same level as other students around them. Also can create problems for the parents' ability to work if childcare is too expensive to access or not readily available in their area. And as we get into school age and high school kids, we know that if they've got instability there, they may lack the skills to advance once they get out into the workplace, and also have to incur higher debts for continuing education. Lack of access to food or not being able to afford it, developmental delays, compromised performance, and of course, it can impact living with chronic disease as well. Transportation can be a major issue, and this is one that we often are working with families to make sure they've got reliable transportation so they can get to work. They can get to the grocery store to get food for their families, or over to the food pantry to get food. They can get to childcare, healthcare, and also, to their faith community, social opportunities, and so forth. Reliability and safety can be a big concern when families can't afford to have a nice vehicle. We know that they tend to then have higher expenses just to keep that vehicle running, which can again cause instability in the other areas. That cost for repairs and insurance. And for our particular area, what we see is that lack of access to public transportation can often be a challenge because many of the services that the families need may be located in Madison, and it's difficult to get to those. If they're not able to afford healthcare, obviously the consequences are, decreasing health, having difficulty getting access to quality care if they can't afford it. If you've ever worked with someone who has been getting health care, through the Affordable Care Act, which is amazing that so many more people are able to be covered, but we know that often their choices are limited. They've got a PPO that just doesn't have access to healthcare providers in their area. So while they may have coverage now, actual access can still be a challenge. We also know that healthcare is often impacted quite a bit by competing work and family obligations. Again, the majority of ALICE families, the adults are working in hourly jobs, so they can't readily take off time from work to go to healthcare appointments. And so, if they miss a shift of work, then they're not getting that income. So there are really difficult trade-offs that they need to consider. And then technology, more and more, I think we're seeing that this is almost like a utility and everyone really needs to have access. So a lot of times if they don't have access to technology or reliable technology, disadvantage in job searches as well as job performance, they can't work at home if they're not able to have a computer or a cell phone that will give them access to the platforms that they need. So we know that not only school work, but also public benefits and healthcare, more and more frequently, you need to have technology in order to access those. And again, we see these factors at play. One thing will impact the other. With learning at home, recently we've had so many families, their kids need supervision for getting their school work done and being on Zoom. And so the technology plays into that. We've got one family that we've been working with quite a bit, single working mom. She works in healthcare. If she were a single person, her income would probably be adequate, but the fact that she's got 4 kids at home makes it impossible for her to make ends meet. So she's got to be out there working, taking on as many hours as she possibly can. She's got a child in high school, one in middle school, 2 elementary school kids. And so it's been falling to those older 2 to really supervise their younger siblings, make sure they're able to keep up with school. So those are the types of challenges that we're seeing here locally on a weekly basis. There's also some complicating factors, as you can imagine. Probably the main 3 are, the pandemic this year, racial disparities, and also the aging population. So with COVID, for ALICE families, they may be an essential worker, and so they're out there putting their health at risk for themselves and their families. It makes it really difficult, as I mentioned, for learning at home and for childcare challenges. And even in those fields where they may work for an employer who's done heroes pay, $1 or $2 more an hour is not making enough of a difference to stabilize their family. We've also got an awful lot of our clients and local families that we see that are kind of non-essential workers, still very impacted by COVID because they're seeing severely reduced employment, particularly in the hospitality area. And again, they have access issues for internet and computer that don't allow them to work at home. So I'd had even, one of our board members recently said to me, I'm not sure I'm interacting with ALICE families all that often. So I'm having a hard time really understanding who they are and what they deal with. And, what I shared is that you're probably interacting with ALICE families, members of ALICE families every day. About 90% of our clients here do work, and they're out there in 1 or more jobs, primarily in healthcare, home health aides, medical technicians. So see quite a bit in home health, childcare workers, retail, fast food, Those are primarily the areas, in agriculture, where our clients are working and just not making enough. So as you can imagine, COVID-19 has really just exacerbated those issues. The other thing too, with racial disparities, as I mentioned, families of color are more likely to face financial hardships, about double that of white households. And we also know that often in communities of color, they're dealing with substandard housing. They may be living in food desert areas where there's not ready access to grocery stores or nearby food pantries. Under-resourced schools, exposure to violence or environmental hazards, and they're more susceptible to serious illness. And we're certainly seeing that with COVID. And then with aging, again, higher risks of loneliness and isolation, particularly related to COVID, declining nutrition and health because of limited access to groceries and preventative care visits. And when senior centers close, maybe not necessarily here, because our senior center, I think, has done an amazing job of keeping services going through all of this. But in other areas, we're seeing families having additional burdens for caregiving of the older adults in their family, difficulty getting meals, and again, difficulty with those social activities. A lot of times what we share with volunteers and donors is to kind of think about, when might your family benefit from support? Again, we know an awful lot of families in the US don't have a lot of savings. And one, financial tragedy or unexpected expense can really throw things off for a number of months. And a lot of times we do see families who only need help temporarily until they sort of get back on their feet after an expense, like some of the examples you see here. On the United Way's website, I think they have a really fantastic interactive exercise. I kind of wish we had the means to do that here as a group today, but I would suggest going on there. I'll give you the website at the end of the presentation. But it gives you a really good idea of the difficult choices that families living at or below the ALICE threshold have to make on a daily basis. And so it gives you a scenario of having two adults, with two children. One of the adults has been laid off, and the family needs to go through a series of choices to determine how they can best stay stable. And so you make selections of which choices you would make for each of those 6 essential household expenses in order to get the family stable again. And it's really disheartening to see, how quickly you run out of money before the end of the month. And again, we're seeing this with so many clients, not only, just on a regular basis, their normal situation, but definitely this past year has been much worse. I will say we're fortunate to live in a community that has a lot of resources, though. And just as all of the factors are interrelated, I think the response is nicely interrelated, and we're even working more to be increasingly collaborative in how we respond. So I wanted to point out kind of the main 6 programs that are happening right here in Waunakee to help families who may be experiencing that financial insecurity. I've shared with you a bit about Neighborhood Connection already. The others I wanted to point out are the Waunakee Ecumenical Board, best known, I think, for having the food pantry, but also they have programs for direct financial support, as well as providing school supplies, covering back to school expenses and holiday programs for families. St. Vincent de Paul, probably 3 different ways we can access St. Vincent de Paul here in the community. One is through the thrift store. And when there are families that qualify, they can get vouchers to get things at the thrift store at no cost. We've also got a St. Vincent de Paul conference, which is volunteers from the 2 Catholic churches in the area. They work with families to, again, provide direct financial support and also get them connected with additional St. Vinny's services through the service center in Madison. Pharmacy, some other case management programs. So again, a lot of things available there, but it requires going to Madison. Our senior center has a great number of services for our older adults, and particularly those who are having financial struggles. So again, they've got 2 wonderful case managers there. that work with those individuals and households, do a lot of referrals to other agencies. They've got their home delivered meals going on, as well as support groups that are still happening, online as much as they can, and some healthcare services as well. Then we've got the school district, and there's an amazing team of social workers. There's one in each school at least, and they also are doing case management and referrals for families with school-age children. Obviously, they've got the free and reduced school lunch program, and there's also a student financial assistance fund that can help students out to meet expenses that are related to their education, whether it's field trips, athletic participation, and so forth. And then through Dane County Department of Human Services is the Joining Forces for Families program. It primarily runs through the school district in collaboration with the school district, but people do not have to have school-age children in order to access their services. And so they also doing case management support. So these are the primary 6 organizations supporting these families in the community. I would also say that there's a lot of support coming from the individual churches and faith communities. Police, fire, and EMS in our community do an awful lot of intervention with ALICE threshold families and make sure that they get connected to resources. There's an organization called Sankofa, which is currently doing the case management for the families who are staying out at the Baymont. Some of you may be aware that that has become sort of a homeless and COVID shelter over the past few months. And so there is an agency working with those families. We also tap in quite a bit to energy assistance programs and the Tenant Resource Center, which again is located in Madison, but they have been administering all of the CARES Act and other COVID relief funds to help avoid evictions for families. So we're working pretty closely with them as well. So again, because the challenges that ALICE families face are all interconnected, I think really the solutions need to be as well. And on the graphic here, I had highlighted direct financial support because that's just one example of, I think, where we can do better collaboration. And just so you know, all of these agencies are currently, we're all talking to each other. We just started these conversations in the past few months about, number one, how we can best collaborate. Second, how we can avoid duplication of services. And third, how we can make entry into getting services and support as easy as possible for the families. Because as you can imagine, it's difficult to come and ask for help. We have people who walk in the door and as they start to tell their story, they just start to cry. It's so difficult to ask. And then it's really traumatic to share your story as well. So the fact that as you access services from each of these agencies, you have to share your story again, as much as possible, we want to minimize that. So those are the kinds of things we're working toward as a group over the next, year and two, hopefully. And again, direct financial support being I think probably the most significant example of that, because there are times that it really is just money that's going to help. And that's what they need most significantly. So each of the programs is very limited in the amount of financial support that they can give. We've got some private groups in the community that also will sort of angel come in and help people out kind of on a secretive basis if one of us contacts them about a family. But again, we want to make this as smooth and easy and trauma-free as possible for families. So as we look at a path forward, we want to place the concerns of ALICE families at the center of our community conversations. Listen to their hopes and their dreams and their challenges and their successes. I really like the mantra, nothing about us without us. We've got a client advisory board in place. And whenever we're thinking about making any changes to our services, that's the group we ask first. How will this impact you? What would make it easiest for you all? And we're seeing, family successes. Those happen too. Just recently, we've had one of our members finish real estate classes and just passed her exam yesterday. So we had a big celebration here, kind of spaced out around the office for her to celebrate that. Other clients that are going to Madison College for different things. We have one who's finishing up a culinary program and has started working on getting a food truck started in the area. So, you know, as much as we can do to support the success and move them above, you know, that ALICE threshold, so there's family stability, that just makes us a more stable community as well. So the report itself is available. I've given you the website there. If you just go to United Way, Wisconsin, you can just search for ALICE. That's the specific link there. But they've got amazing resources, a lot of interactive charts and graphs if you are a data geek like I am, and just ways that we can all come together